I'm Loveness Nyirenda, Principal Nursing Officer, working at Queen Elizabeth Central Hospital. I've been working at this hospital for almost more than 10 years, and I'm a manager overseeing the activities in the pediatric department. But also, I'm a palliative care nurse. At one time or the other, I'm able to do practical work, looking at the care of the patients, especially terminally ill patients who have been referred to palliative care team. And also, I look after patients with cancer in oncology ward because I'm there as a supervisor, and in a week, one day, I'm able to spend with these patients in cancer ward. The problem which we have mostly, and challenges which we have mostly for our patients with cancer, is that most of the times these patients, they are referred in our institution very late, and they all come in advanced stage. And once they come in advanced stage, sometimes it's very difficult to see the response and recovery of these patients. And also the problem which we have is we've got shortage of nurses. Even though in pediatric department is better than adult department, because in pediatric department we've got special ward, and in that special ward is only for cancer patients. While when we compare with adult ward, we don't have any special ward. Patients are mixed in a ward. We have been given only a small side ward, whereby it's a four-bedded ward, a four-bedded side ward, and yet we get a lot of patients from all over Malawi who are referred at Queen Elizabeth Central Hospital. Even though we have got 4 central hospitals, but out of the 4 central hospitals, where we have got a specialist oncology, special doctors who have specialized in oncology, is only Queen Elizabeth Central Hospital. And also they do they manage at Central Hospital. But other hospitals, they don't do any management of oncology patients. As I said, we get a lot of patients from other district hospitals referred to Central Hospital, to Queen Elizabeth Central Hospital, and also neighbor country like Zimbabwe. We also get patients through Mulanje come to Queen Elizabeth Central Hospitals. So most of the times our wards are overcrowded with the patients with cancer, and yet we need to give care to these patients. And when we look at the nurse-patient ratio, most of the times it's either 2 nurses against probably around 25 patients, sometimes more than that. And the clinics follow up patients who come for chemotherapy, follow-up chemotherapy, they also come in the wards. So sometimes the patients are more than the nurses who are supposed to care for these patients. The second issue which we have got a problem is lack of resources. Resources, I'm looking at issues of drugs. Drugs, cancer, chemotherapy is a bit expensive. And the government has not put it as a priority as they do like other diseases like malaria, HIV. Cancer is not a priority, it's just coming up. As I said, drugs is not a priority for the government to procure drugs for cancer patients. So sometimes we're able to get drugs as a donation from well-wishers, other countries who wish to donate. But sometimes we are able to access these drugs from the government. But even though sometimes they come in an erratic season, you can get them this time, the other time they are in short supply, the other time they are not there. As a result, it's somehow difficult. But we wished they are always available and our patients are able to access these drugs. Because some of these cancers, they respond well to chemotherapy. And the other problem is that some other conditions which need radiotherapy, but we don't have any radiotherapy program in our country. So if there's any patient who has been recommended for radiotherapy, they are supposed to be referred to other countries under the government sponsorship. And yet, with the financial constraints which we have in the country, sometimes it's very difficult to access that sponsorship. Sometimes it takes so long, and during that time while the patient is waiting, the cancer is getting worse. As a result, it reaches at a time that then the doctor recommends that there is no need for this patient again to go for radiotherapy. The other problem, challenge which we have is nutritional support. Even though we are able to provide some nutrition, but when we look at cancer patients, they really need good, nutritious foods to improve their health. But unfortunately, we are able to provide the ordinary meals from our hospital. As a result, our patients get a bit of time to improve their health. Even though we've got a program of providing peanut butter to our patients, but still it's not enough. They need more than that. Those are the few challenges which I can mention on the issues of patient care. But the other challenge is for nurses. Most of us, we did basic nursing, and the knowledge which we have on oncology nursing is just basic, not in details how can we care for these patients. And sometimes it's really a big challenge. We are unable to provide holistic care to our patients because of maybe lack of knowledge. So even though we have got little knowledge, but we wish we have more than what we have. And this can only be done through ongoing training, as we have done right now. This is the first training which has happened in Malawi, specific for oncology nursing. Otherwise, since I've been in the system, I've never had a special training of oncology nursing. We have been doing some other in-service training. What I can say about the workshop is that it has been a very good workshop, and we have gained a lot of information out of this workshop, which was lacking in our knowledge. Especially, we have covered a lot of topics during this workshop. To mention a few is basics about cancer, and also treatment modalities for patients with cancer, especially issues of surgery and chemotherapy, and also issues of communication skills, which is also a big issue in our working place, which I think after this course we are going to improve, because most of the times the way how we talk to our patients is somehow difficult, and sometimes some of these patients that are having problems to cope with treatment because of the way how we are communicating to them. And we have learned that cancer is a terminal disease, but sometimes it can be cured. As a result, the way how we communicate to the patients, we need to look at issues of holistic care, looking at all the issues. While we are caring for physical symptoms, we need to be looking at issues of psychological, social, spiritual, all those issues, so that this patient and the family members can cope better with the disease process. And also issues of psychological support, which is really critical to our patients, especially when they are going through these problems. And it was really a good session to our participants. And also, maybe to mention a few issues of research. Research is an area which normally in Malawi we don't do as nurses. Doctors are better, but nurses we only do when we are maybe doing post-basic nursing. We have gone to school. But once we come back, we don't look back and see how can we do some small research which can also be our maybe area of how we can improve our performance on patient care. But most of the times we are just looking at the issues of work. That is all, not looking at the issues of research. And this information of research has given us an idea how best we can handle our patients. Research is also very important in patient care. So it's one of the areas, maybe once we go back to the work area, we need to look at and see what topics we can research on and work together with our AfrOx team and see how they can help us to do the research. I know we have been unable to do it because we don't have enough information how we can do the research. We need somebody to help us how we can do the research. And with the program which we have had on this workshop, I'm just hoping that things are going to improve. And also, we have also covered issues of maybe how we can prevent cancer. We didn't know that cancer, we can learn how we can prevent, how we can communicate to our patients on prevention of cancer. Those are the issues which we didn't know. But out of this course, we have known how we can prevent cancer. Like, for example, type of foods, fruits, vegetables which we can be eating. Doing exercises is one of the areas which we can be doing to prevent cancer. There is a lot which we can communicate to our patients on prevention and also on issues of early diagnosis. We have been talking of patients coming to the hospital very late because we are unable to diagnose these patients early at community level and also at health center level and also at district level. It's one of the areas which we need to look at as a country and see how best we can handle it so that we can advocate issues of cancer even at a community level so that they are able to identify these patients at early by use of either posters, health educations, all those issues, which I think will be working hand in hand with the AfrOx so that we can see how best we can improve on this one so that we are able to identify these patients early and come to the hospital for treatments of which we can easily improve on cure rate. Because this time, even if we are able to cure some of the cancers, but still we have got a lot of relapses and also we have got a lot of treatment failure because most of them, they come a little bit late to the hospital. As I said, a good number of patients only go on palliative care rather than maybe on cure treatment. And I would like to thank the organizers and also the sponsors who gave us this funding, AfrOx, and also the organizers who have been working hand in hand with the AfrOx team, who have managed to find this funding and come, the facilitators come all the way to Malawi to train the nurses and the doctors and the clinical officers, and it was a good training. It was really a good training. We've gained a lot. And as we are going back to our institutions, I'm hoping that we are going to implement whatever we have gained from the workshop. And I'm hoping that the skill will also improve on the issues of care to our patients. And thank you very much. Extend our thanks to even those who are in the organization of AfrOx. that we really appreciate, and I think it will be working hand in hand. In case next time we also request for more funding, please help us. We will still be talking about these issues, because the nurses who have been trained is just a small number of nurses, and we have just captured only nurses who are working in oncology wards. And yet, these cancers is not only oncology wards, also we nurse these patients in other wards like surgical wards, gynae wards, general wards, and we wish that all those nurses also they have an access of this training so that we can be working at the same pace. So probably we might have problems to access the funding within the country. We'll come again and request for more funding so that maybe we can again train other nurses so that we can improve on the care of cancer for the country. Thanks.